My name is Arabella Gibson. I'm the CEO of Gidget Foundation Australia, and we're an organisation that supports the emotional wellbeing of Australian families who might be experiencing perinatal mental ill health. The perinatal period is the period from conception to 1 year postpartum. You might know of the antenatal period, that is before we have a bub, when we're pregnant, and then the postpartum or postnatal period is after having a bub.
The early days can be tough. The world can feel overwhelming. Everything is new, and they haven't learnt how to cope yet. They don't understand why they have these feelings, or how to ask for help. This is the time they need us most. Just to know we're there. That they're not alone. Gidget Foundation Australia is here for you.
The Gidget Foundation began 23 years ago through a great tragedy. A beautiful girl whose nickname was Gidget sadly took her own life after suffering unrecognised postnatal depression. She was the kind of person that you could never have imagined would have been experiencing this illness. And of course the stigma, the lack of awareness and the lack of education 23 years ago was significant. But Gidget was dynamic, she was fun, she was vibrant, she loved everything red, to give you an idea of her personality.
Gidget Foundation Australia is a not-for-profit organisation that supports the emotional well-being of new and expectant parents.
The Gidget Foundation started after the death of my daughter, Louise, nicknamed Gidget. She was a beautiful girl. She was amazing. She was positive. She had a beautiful life, a beautiful husband and baby and home, and she had it all. But she struggled. And tragically, she left the world too early.
So to see that someone like that could be experiencing this and leave her beautiful 9-month-old baby girl was just incredibly tragic. And so whilst we began through great tragedy, we now have an incredible legacy to Gidget and her family. Her 2 sisters and her friends came together and they decided that what had happened to Gidget, they didn't want to happen to anyone else ever again. And so through the efforts of fundraising, or education and awareness, we have slowly developed over time. We now have 32 Gidget houses Australia-wide, offering a national service as well as telehealth. Each of those houses offer one-on-one services through psychological support, utilising the Better Access initiative. So we do require a GP referral and a mental health care plan in order to offer the services. To date, we've provided 92,000 free appointments to families Australia-wide. And it's really been incredible because we know that just in the last 4 years alone, we've actually saved the Australian economy $108.9 million in healthcare, presenteeism, returning to work, and general child welfare as well in terms of that support that we've offered. So it really is a significant service, and it's one that we will continue advocating for expanding and growing, and we know that the government is behind it. We know that there's 100,000 Australians every single year that are diagnosed with perinatal mental ill health. That equates to 1 in 5 mums and 1 in 10 dads every single year. But we know there's so many more that go undiagnosed and that really do need the support when they're developing their family and creating that opportunity to thrive for them rather than just to survive. We know that at the Gidget Foundation, the work that we do absolutely changes lives. We offer free perinatal mental health support through a wonderful network of over 175 allied health clinicians, and they provide those services to families over the Better Access initiative, so including those 10 sessions. But we also have a compassionate fund where we go on to support roughly about 25% of our clients with further sessions beyond that 10. We are expanding at a rapid rate to deliver services to the people that really need this service. I mean, we've got a really significant wait list. But we know that there's around a 32% shortage of mental health professionals that can deliver the services that we need to deliver. We also know that based on our projections by 2030, we will see that number grow to around 42%. So really, addressing that issue and saying, well, how can we expand the workforce? How can we train people within the mental health space to support the perinatal period? Because if we can really work with people to support them during that period, we can actually reduce the impact both generationally, but also through that period from adolescence and into adulthood as well. So it's really important that we grow the workforce and expand it and give it the knowledge that it needs to deliver. One of the things we do at the Gidget Foundation is we look to innovate. And knowing that the expansion of the workforce was one of our biggest problems and something that we needed to mitigate, we thought, well, why don't we rely upon the wonderful workforce that we have? We had a very strict recruitment phase where people would have to come to us with a minimum of 3 to 5 years of perinatal experience. Now, there's only a finite number of people out there that have that amount of experience in the perinatal period. So what we did was we decided to utilise the incredible experience that we had within the foundation to train, mentor, develop and supervise people that might not have had that level of experience. They were still very experienced as, for example, psychologists or mental health accredited social workers, but didn't necessarily have that key experience. So in developing the program, we thought, okay, if we can utilise this wonderful experience that we have already here and the expertise that we have to train, mentor, develop and support these people through a program and give them a job at the same time, what a win-win. And so that's how it was born. What we did was we, first of all, developed a supervision program, and that involved bringing people in from all over Australia, both geographically and also within the academic world and also within the clinical world in terms of their practice as well. So, for example, one of the people we had was a professor with a university, and he was supervising along with 5 others, and he saw the program in action and he really saw the delivery and what we were doing and how it was working. We developed education modules. We were doing weekly supervision with, it was 1 supervisor to 5 workforce graduates. That's what we call the people that are part of this program. And it progressed from there, and it was a really wonderful opportunity because that particular professor also happened to be a professor at the university, Federation University, and together we collaborated and came up with the idea of actually turning this workforce program into something that had an academic qualification. And so here we are, the first ever Graduate Diploma in Perinatal Mental Health. When we take the graduates on, part of the program is such that they have an opportunity to work with us, both for the year of the program, but also for an extended year thereafter. Obviously, we'd love to keep them as long as possible because we've invested in them and their development, their education and their training. But the beauty of it is that there's a workforce there that's available to support the people that are there, and they're able to deliver the services that they've been educated into. If you are a registered psychologist or a clinical psychologist or a mental health accredited social worker or an occupational therapist and you have an interest in the perinatal period, then we'd love to hear from you. The opportunity exists to take on a number of graduates every year. It's an expression of interest. It's on our website, gidgetfoundation.org.au, and we are always looking to take on more rather than less. So there's opportunity galore, and I would really encourage people to get on board and apply.